Outside the US Centers for Disease Control, more than a clapping out for departing colleagues, a very public show of solidarity against the Trump administration. Senior leaders resigning in protest at the dismissal of their boss on what they say are political grounds.
And what makes us great at CDC is following the science. And so let's get the politics out of public health.
Right now, when you look at the devastation that's happening to our staff, our campus, the programs, we won't forget you. We're just now going to really advocate for the great work you all do.
Susan Monarez was only weeks into her job as CDC director when she was fired on Wednesday, the White House saying she was not aligned with President Donald Trump's mission to make America healthy again. But it was a clash with Trump's Secretary for Health and Human Services, Robert F. Kennedy Jr., that sealed her fate. A former colleague who spoke to Monarez on Wednesday said she claimed Kennedy had asked her to act illegally by firing officials without cause and unscientifically by endorsing recommendations on vaccines that she didn't believe were based on evidence. Kennedy says he won't talk about individual personnel matters.
There's a lot of trouble at CDC, and it's going to require getting rid of some people over the long term in order for us to change the institutional culture and bring back pride and self-esteem and make that agency the stellar agency that it's always been. I'm very confident in the political staff that we have down there now that they're going to be able to accomplish that.
But it is the political element that worries senior health professionals, among them one of Monarez's predecessors in the job.
This is unprecedented. There has never been a CDC director fired. And it appears that she was fired for standing up for saying things that are true and refusing to rubber stamp things that are putting ideology into the recommendations of what vaccines our kids should get.
Kennedy has long been a critic of widespread vaccination. This week, the U.S. Food and Drug Administration, now headed by a Kennedy ally, issued revised guidelines targeting the latest COVID-19 vaccines, now recommended only for those over 65 or with certain pre-existing medical conditions, instead of the previous yearly jab for children as young as 6 months and up. Over the summer, Kennedy also dismissed the serving members of the ACIP, the body that advises on vaccination practices, replacing them with a more vaccine-skeptic panel, due to meet for the first time next month. Monarez was quizzed about the move at her Senate confirmation hearing in June.
The members of the ACIP do need to go through a thorough ethics review before they are allowed to participate in those critical meetings.
What will you do if the committee votes to remove vaccines from the vaccine schedule or to not approve new ones in opposition to clear established science?
So I will be looking at how the ACIP members are able to evaluate this complex scientific information.
This week, Kennedy gave a window into his own scientific method for discerning childhood health.
I'm looking at kids as I walk through the airports today, as I walk down the street, and I see these kids that are just overburdened with mitochondrial challenges, with inflammation. You can tell from their faces, from their body movements, and from their lack of social connection. And I know that that's not how our children are supposed to look.
Concerns are spreading beyond the US as well, given the CDC's global role in vaccination guidance. Today, the government here is announcing that a chickenpox vaccine will be added to the measles, mumps and rubella jab from January next year. But already, only 83.7% of 5-year-olds have been given both doses of the MMR, well short of the 95% global standard. So what effect might a shift in US policy have on public sentiment here?
It's gone full circle because it came from one of our doctors who was struck off, who's now very prominent in America and very influential. And naturally, across both sides of the Atlantic, lots of conversations happen. And I think we are influenced by American culture as much as many other countries are in the world. So yeah, I think lots of the misinformation has stemmed from there.
This month has already seen reported real-life consequences of vaccine-skeptic messaging. A gunman firing hundreds of rounds at the CDC building in Atlanta, Georgia, killing a policeman, then himself. All of it contributing to what is reported to be a bleak, even tearful mood inside the agency. Its incoming acting head has been named as Jim O'Neill, Kennedy's deputy at the health department, seen as likely to bolster his boss's moves on vaccine reform.
All right, here we are in the bowels of the Pentagon. for the Pete and Bobby Challenge.
Earlier this month, Kennedy, a proponent of testosterone as well as blue jeans when it comes to workouts, took part in a fitness challenge with the Defense Secretary. 100 push-ups, 50 pull-ups. If so far his tenure has been characterized by this sort of bluster and eccentricity, in the coming weeks, the consequences of his decisions on public health may start to hit home.